Good day, guys. I'm taking you to work with me. So, guys, I'm here at my patient's house, and today I'm going with the parents and the patient to see the doctor. It's part of my duty as a home health private duty nurse to go with the parents and the patient when they see the doctor. Sometimes they would need you to be there so that way you can report this to the agency, and at the same time you can monitor the patient after the doctor's visit. There are several reasons why a patient goes to the doctor. So a doctor's visit is a meeting between the patient and the doctor for some health advice. If you see signs and symptoms, for example, for signs and symptoms of infection, then you need to go to the doctor to see what's wrong with your patient, and the doctor can give a diagnosis. So today we're going to the doctor, and we're going to see what the doctor has to prescribe to this patient. So and usually agency's policy is that a nurse cannot take I mean a nurse cannot take her own car and use it to transport a patient. You can either follow the car of the parents with the patient, or you can be in the car with the patient. It's not allowed to be using your own car because there are liabilities for that. So I receive report from caregiver or parent and perform assessment. I'm trying to get my client ready for chest vest precaution. And this one I'm showing you is a machine. So the machine has a tubing. You connect the tubing to the machine and the vest. It also has already a setting that is already programmed by the supplier based on the doctor's order. So this is the chest vest. It has velcros on the top where the shoulder is and buckles in the front. So you need to secure this when you put it on the patient. So I'm taking a carry-all bag where I put all the supplies, a feeding syringe with extension if needed, feeding formula and water, medication if there's a scheduled medication to be given, extra syringes, paper towel wipes, diapers, clothing, a spare tray, one size regular size and a one size smaller in case of emergency, suction catheters. Make sure that the suction machine is fully charged and clean, the oxygen key, and you need to check the tank if it's full if your patient is oxygen dependent. So we're heading to the doctor's office now, guys, and I'm following the patient's car. So at the doctor's office, at the reception, you need to check in and you have to wait for your name to be called out. So once your name is called out, they take you to a hallway where the patient's vital signs are taken and recorded, and the medical assistant would usually ask the reason for the visit. And then you're taken to the examination room where you have to wait for the doctor. Doctor examines the patient, orders for some tests, and gives a prescription. So before you leave the examining room, you need to get a prescription, a copy for your records, and also an instruction sheet. And before you leave the clinic, you make sure that the patient's demographics, information, contact number is updated. That way, orders for medication will be given to the right pharmacy. So we're heading back to the patient's house. So after the doctor's visit, when you get into the house, you need to make sure the parents understood the instructions given by the medical assistant or the doctor. You need to review the medications. Like if the doctor prescribes some medications, you have to give instructions if what's a dosage, how many times you have to give it. For example, if it's an antibiotic, if the doctor says 7 days and 2 times a day, you have to really make sure that they're following that, because some parents, they just rely everything to the nurse. So teaching them and giving them instructions, reviewing with them the medications, and also telling them to report for any side effects. So report is given and received, and I'm heading home. So guys, when I'm exhausted from work, I would play some music to pump me up or call my sister so that I won't fall asleep while driving home. So guys, if you like this video, please like and share. If you haven't subscribed to my channel, please consider subscribing and hit the notification bell so I will see you in my next video. Hey people, I'm home.